Stewart, how are you?
Dr. Stewart, I'm Kai. Nice to meet you.
Hi, Kai, and this is Cleo.
This is my daughter Cleo. She's almost a year old and she's got 6 teeth.
Goodness, Cleo. Let's see how many teeth you have in there.
Open up.
See them. Very, very good. Well, Kai, how did you happen to bring Cleo to see us? I love seeing kids at this age, but a lot of times parents don't get them in until they're 3 or 4 or sometimes even 5 years old.
Well, our pediatrician said that we should bring her in as soon as she had teeth, and we kind of wanted to wait till she had more than 1 or 2. And our friends brought their kids here, and we have a 3-year-old that we bring here, and we thought we should bring Cleo here too because we love it
excellent.
here.
I can't tell you how happy I am that you brought her in. I love seeing kids at this age. It's a great age to get them started. And what we're going to plan to do today is just go over some of the basics of home care and oral health for infants and toddlers. We'll kind of demonstrate to you how we're going to do, how I hope that you guys can manage toothbrushing at home. Take a look around in there, count her teeth, and talk a little bit about what to expect in terms of future teeth coming in and that sort of thing. So the other thing I need to tell you is that a lot of times at this age when we do the knee-to-knee exam and she's tilted back in my lap, sometimes they get a little upset and cry, but we expect that. We're not going to do anything that hurts, I promise, Cleo. Nothing that hurts today. And my guess is that she's going to respond to this pretty well.
Perfect.
Are you guys brushing her teeth at home now?
Yeah, I wouldn't say every day, but I would say about every other day or so. And I have a little rubber toothbrush, and we have some like natural toothpaste that we, the kind that she can swallow.
Well, good. Well, one thing, I'm going to send you home with a toothbrush just her size today.
Oh, perfect.
So if you'll have a seat, I'm going to go get my my gown and gloves on and stuff, and we'll get started.
Sounds great. Thank you, Doctor.
Great. Well, Miss Cleo, look what I have for you here.
Oh, yeah. Should I?
No, just go ahead and turn her around.
All right.
Talk about this and just kind of get her warmed up to the mask and stuff. Look what I have here. There's Tigger on there. Would you like to hold this toothbrush? Would you like to hold this? Here you go. Good girl. Very good. You know what that's for, don't you, huh? Does Daddy brush your tooth at home with the gum, with his finger gum bum, huh? Yeah, look at that. Okay. All right, let her watch me put my gloves on here too. Okay, look at this. Feel my hand. Does that feel funny? Yeah. Does that feel kind of funny? Why don't you get a little over my shoulder here too, Wilson? Just kind of get some her expressions. Okay, would you like to feel my gloves? Here you go. Ooh, those feel funny, don't they? Yeah. Now watch what I do with my mask too, just like Halloween. She hasn't been through Halloween yet, has she?
She did one Halloween so far.
Well, there's my mask. And it's just me behind the mask today, okay? You are doing so well. So let me feel her nice little cheeks here. She says, oh, don't touch me. You don't need to do that. So, she's been good and healthy here lately. No coughs, no rashes.
No, nothing.
Nothing like that. Okay, good. Okay, well, Cleo, thank you very much. Now, Daddy, let's let Daddy do it. Here, let's let Daddy do it. That's okay.
There we go. Cleo.
Oh, she's good girl. Well, I'm going to show you a position now, Kai, that is really good. That you kind of almost have to tag team this with Mommy.
Sure.
But have her face you and just tip her right back here in my lap. What a big girl you are. Yes, what a big girl you are. And look what I have here. Huh? Look what I have here. Daddy, just hold her hands there for me.
Sure.
Okay, well, I see we have 4 teeth on the bottom and 2 on the top already. Cleo. Just going to look around in here and see what else we see. Well, the next teeth to come in now are going to be your upper lateral incisors. And then we skip one. The first baby molars come in behind here next. Okay, let's brush these things now. Oh, good. Good girl. Okay, could you put just a little toothpaste on here for me? I don't know what kind of toothpaste you're using, but we recommend just any of the children's toothpaste, and just put a tiny little smear on just about that much, not very much at all. Okay, let's just brush it here. Oh, good. Good girl. This way you can see, and even if they cry, you can see in here really well. Oh, goodness, now we're really bad. Good girl. Okay. Let's dry it off with our tooth towel now. Okay, the other thing that we're going to need to start to do here pretty soon, this is a little floss threader. And especially on these teeth that have no space between them now, just run it down there. These guys all have plenty of space now, but as the other teeth come in, those are going to close up. Okay. So we're going to want you to be doing this and brushing a couple of times every day. Now, as long as we've got our little mouth open here, I'm just going to take a look around here, make sure we don't have anything else going on. Oh my goodness. This is her upper frenum, and that's just about exactly where I would expect it to be. Her gum pads are all really good. Tongue looks normal and everything else. And I tell you what I'm going to let you do is I'm going to have you sit her up here for just a second again. Good girl. There we go. Well, goodness. She says, why did you let him do that to me, Dad? There now. Everything's fine. The one thing we're going to do one more time is I'm going to put a little, it's called fluoride varnish on. Put it on my glove here at first, and we're going to paint it on with our little toothbrush, our little paintbrush here. Look what I have here, Cleo. Look at this little brush. She says, I don't want to have anything to do with that. That's okay, sweetheart. That's okay. It's just a little brush. You see, we put this on here, and then we put it on your tooth just like we put it on your finger. You don't want to do that. Okay. All right, Dad, let's just give her back one more time here.
There we go. Cleo.
Okay, Daddy, hold her hands one more time for me. Good girl. Okay, just going to paint this in the front and the back. Good. Alright, and there we go. Okay, that's all. You can sit her up, Daddy. Excellent. Okay, the other thing we can do is use a handheld light and a mirror if we need to get in there and see anything other than what we've been able to see with the toothbrush. You can see under Cleo's tongue now, and you can see the backs of her teeth really well here. And if you can see that, have you got a view of her holding the light, Wilson? Okay.
Yes.
Good girl. Okay. Not even a tear. Well, everything looks great in there. Those teeth are right on schedule. Between now and the time that she's 18 months to 2 years of age, the rest of those teeth are going to come in. A lot of times the molars, when they start to pop through, they get a little bit fussy and want to chew on things and salivate a lot. That's pretty normal, nothing to worry about. I would like for you guys to focus on maybe starting a regular 2 times a day brushing with her, just to get her used to it. Does she fuss like this when you use your finger in the gums?
No, maybe a little bit sometimes, but no, not really.
Okay, well, I think I wouldn't be surprised if she does the first few times, but if you kind of make a game out of it and kind of sing A, B, C, D, E, F, G, or Mary Had a Little Lamb, a lot of times that's enough of a distraction. And she's none the worse to wear for right now. You know what? I think I have a very special sticker for you, Cleo. Look what I have here. Look what I have here. Oh, there's Donald Duck. And this is the smiley face for you. Would you like to take those? There you go. You did so well today. And here's Donald Duck.
Want to get this one?
Good girl. Very, very good. Well, we're off to a great start. Couple of other things I'd like to talk to you a little bit about is Cleo still nursing or?
Still nursing.
Still nursing.
She's
okay.
going to be weaning just in a few weeks.
Okay, excellent. Does mom nurse her at night? Other than, I mean, does she sleep in bed with you guys and nurse?
No.
Okay,
no.
good.
And
Good,
I give her a bottle before she goes to sleep.
Okay, excellent. Well, what I'd like you to do is, can I have another 2x2? She's a little what I'd like you to do is maybe do that last brushing after she has her milk before she goes to bed.
Okay.
Here, let's just dry your cheek. There we go. Oh, I know, it's just terrible, isn't it? Well, you know what? You did really good today. Yes, you did. You did really good today. And could you put her brush and things in a little bag for me? Cleo, look at all these things you get to take home today.
Oh, look at this.
Yes, all those things you get to take home. We've probably asked you with your older kids what you guys do for snacks and between meal types things. Do you have a lot of sugary foods, or do the kids have exposure to?
We don't. No fruit juice and no.
Excellent, excellent. Well, I don't need to talk to you about that then, because a lot of folks think that the juice is fine, but boy, it contains quite a bit of sugar, and we do see kids that have lots of cavities, and the only real problem is that they have a bottle with juice in it all day long. But I'm glad we don't have to worry about that here. Well, what I would like to do is schedule Cleo back to see us in about 6 months, and as a matter of fact, if we could schedule her at the same time her big sister comes in, I think that would be great. It'll save you guys an extra trip as well. And in the meanwhile, I'm going to give you my card with my telephone number and contact information on it in case you have any questions that come up in between time, or if any time we have a fall or bump a tooth, or that you think we need to see her before the 6 months, you'll be able to get back in touch with us.
Oh, that'd be great. Thank you, doctor.
But so my assessment is that we always do what we call a caries risk assessment on babies, and I think Cleo is definitely low risk. And the only suggestion I would have at this point would be try to bump that brushing up to twice a day, and just use that tiny smear of toothpaste. Even on the older kids, it doesn't take a whole lot of toothpaste. They swallow most of it at this age. So you living in San Francisco have fluoridated water. We have the San Francisco water is excellent water. I drink it out of the tap. It tastes so much better than where I grew up. But it has the right amount of fluoride in it for kids. She doesn't need any fluoride supplements with the fluoride in the water and the little bit she's getting in the toothpaste. So I'm sorry that this was so traumatic for this beautiful little girl. And she's already wadded up her sticker, so I'm going to let you take this one home.
All right. You want this one?
Not if I have to do that again. Okay. Let me ask if you have any questions at this point about anything that we've discussed, or anything we haven't discussed.
No, I think that's great. I'll start brushing her twice a day now.
Excellent, excellent. And if you get home and Mom has any questions, don't hesitate to shoot me a quick email or give me a call, and I'll do my very best to answer them. So, Miss Cleo, thank you for being such a good girl today, and thank you for having healthy teeth, and we'll see you back in 6 months, okay?
Thank you.